Welcome to Faith, Purpose, and Freedom. My name is Kayla Roth, your host. Today, I have the honor of having Dr. Deborah Bowers with us. She is a pharmacist. She is going to educate us on functional medicine, and we're just really excited to have you with us today. Thank you, Debbie, for being here.
Yeah, thanks, Kayla. I enjoy talking with people about my passions, which is, of course, Christ and helping people get better.
Yes. So, do you want to start with just kind of telling us what led you into your journey with Jesus and how that kind of come together with pharmaceuticals and your faith?
Yeah, so Jesus has always been a part of my life. I don't ever remember a time that I didn't know about Jesus and he had a huge impact. However, Um, my personal walk didn't really happen until I was 14, where I kind of went from the head knowledge to the heart knowledge and accepted him as my Lord and Savior. And then, I pretty much, I would say, did a typical, just, not that I was crazy wild or anything, but I went to college and that probably wasn't my number one focus. I did finally meet my people, which kind of helped me get back focused. And then really when I had children, I
Right.
was like, okay, they were huge in changing my outlook on life. And I really wanted Christ to be a big portion of that. So I would say I got real serious and deeper in my faith in my 30s. And I don't know how people get through the struggles of life without having a relationship with Jesus Christ, to be honest. Through a lot of my life issues and trauma and things, the church and my relationship with Jesus Christ were paramount and probably the only reason I'm still standing today. Someone who took us in when we had to leave a very tumultuous situation was somebody in my church who also happened to be a pharmacist. So I got a lot of exposure and I got to see how he helped people. So since 10th grade, I was like, I want to be a pharmacist and I really wanted to help others. And then I started to kind of realize we are helping people to a certain extent, but we don't ever help them get completely better. And that's what kind of started me down the functional
Yeah.
medicine journey because I started having my own health problems that I really just couldn't get answers from in traditional medicine. And so I started to go down the functional medicine rabbit hole and really found that that's where I shine with the problem solving and helping put pieces together for people to know what to do and what not to do to help their situations.
Hey, I love that. So, one thing you said is, I don't know how people really get through some of the obstacles and challenges in life without having Jesus as their cornerstone. And honestly, I just have to say, through ministry, if there's one thing I've learned, they don't. They don't. They continue to suffer and struggle. And I think it's until we hit that rock bottom, because most of my life, I always knew who God was. It
Hmm.
was until I accepted who God was
Right,
and chose to be in a relationship. And
right.
then I started to see things in my life happening. But honestly, I never got through anything. Like, I struggled, the shame, the guilt, the condemnation, the beating myself up continued to come back time and time again until I finally grew in that relationship. So, I mean, and it's hard because, you can't force it on anyone either. Their spirit has to know for them.
Yeah.
But
Yeah.
the other thing you said that really caught my eye was your children, and it's amazing. Our kids really do phenomenal. That's what did it for me, was my kiddos hitting their teenage years and realizing, like, I really needed to get my crap together.
Hmm. Yeah. It really can put things in
So,
perspective for you.
yeah, it really can. Yeah. So, can you explain just to us a little bit, because even me, I don't really know what is more of a definition of functional medicine. Can you explain that to us?
Yeah, so functional medicine really gets down. So, well, let me go over what traditional medicine is first. So,
Okay.
you have an issue, you go to the doctor, you say, "Hey, I'm experiencing these symptoms," and then the doctor says, "Okay, I'm going to give you this medication." So the medication, 9 times out of 10, doesn't get to the root of what's causing you to have the symptom. It just covers up the symptom, which sometimes that is really necessary. I explain to people all the time, it doesn't matter if I can help you recover from a heart attack if you die from said heart attack, right? Um,
Right.
so functional medicine looks at, you can kind of use the analogy of if a or a plant is dying, what do we look at? We don't just look at the leaves, right? We look at the soil. What's going on in the
Right.
soil? What do the roots look like? What does the air look like? What does the water that we're using look like, right? So, like, we're looking at everything else. We're not just looking at the symptoms of the leaves are wilted. And so we're
Yeah.
looking deep to find out why something is happening and trying to address that. And then once you address that, then the symptoms start to go away.
Huh. I like that. And so I'm just gonna throw myself under the bus for a minute. So in October, I had a full hysterectomy. And a lot of what my body has been feeling and different things, and doctors just want to say, like, take this medicine and take this medicine and take this medicine. But it really boiled down to learning that I have a gluten intolerance. And so once I quit eating gluten at all, some of my symptoms started to go away, and now some of the weight is starting to come off slowly. Wish it would come off faster, but it is. And so I think it's really important to understand the root cause.
Yeah, I think inflammation is a huge piece of a lot of people's story. And inflammation can be
Yeah.
for various things. It could be from gluten, it can be from dairy. There are just some things that are just very inflammatory. It could be from your body is producing a normal amount of inflammation, right? Because like we want inflammation. So like if I cut myself, I want those inflammatory mediators to go and get to the spot and make a blood clot and that kind of thing so I don't bleed to death, right? So like it has a purpose.
Right.
It's when inflammation just becomes overrun and kind of out of control that it is just wreaking a lot of stress and oxidative stress all over the body. And sometimes it could just be you don't have the right nutrients to get rid of the inflammation that your body is naturally making for your survival. You just get overrun with it. So, like, I see
Right.
things from both ways. Sometimes it's an input issue, sometimes it's an output issue, sometimes it's a combination of both. Very rarely is it just one particular issue that is driving a lot of people's symptoms.
Yeah. So how does functional medicine connect with our nervous system?
Yeah, way more than I wanted to admit in my own journey, I can say. Kind of think of your nervous system like your phone's operating system. So, like if you don't have the right updates, how all of your apps won't work correctly, or you can't even get the thing to
Right.
turn on,
Nothing
or
works.
right. It just kind of like reboots, like we were talking about having internet problems earlier today. Well, that's kind of the same thing. If your nervous system is completely dysregulated, it can't really heal because it thinks the environment still isn't safe and it thinks it needs to protect you from something. So that was one of the things that I wish I had started working on earlier in my journey. And I kind of worked on everything else. And then I kind of came back to, well, I'm not where I want to be. Okay, maybe this has some more science to it because it's kind of what I would say the woo woo part of the functional medicine
Right.
piece. But there really is a lot of articles and research into the vagus nerve and how it regulates people's health.
Okay. So, what exactly is the vagus nerve?
So think of the vagus nerve as like the communication pathway. And we used to think that it was kind of like from the brain down into the gut, but actually it's probably the other way. It's probably the gut is sending a lot more signals to the brain. And, it is regulating just every aspect of our life. I actually have a handout that we can put in the show notes if you'd like, that are just some vagus
Okay.
nerve exercises, that just simple things that people can do. It
I
doesn't
love that.
require money. Something that I like to do is humming. Something as simple as humming activates the nerve and just gets you in changing your just the way your body feels safe. And I remember I used to hum all the time, and I don't remember when I stopped, but I remember thinking when I read this book about the vagus nerve, I was like, I don't remember the last time I hummed. And then one day I just remember I started humming again. People started saying, "Oh, what are you humming?" And I'd be like, "Oh, I don't know. I didn't even realize I was doing it." Right? So like there are things like gargling can be very beneficial. Humming, let me think of some other things. Breathing, right? Like they don't cost money, but you just spend maybe
Right.
2 hours a day doing them, and it really can help reset your nervous system.
I did not know that. And so, I have been even for myself, I I went from living in survival mode most of my life to transitioning to being an author and a coach and ministry. Oftentimes you take other people's feelings and emotions in a lot, and I'm very empathetic, so I've had to learn to discern, is this their feeling or mine? So this is something I'm very into breath work, so and meditation, so this is something I'm going to implement into it. Thank you for sharing that. That's awesome.
Yeah.
So, what are some signs that someone's nervous system is dysregulated?
Well, everybody is different. They usually don't even realize they're in survival mode, because it's just their normal. Like, and I can
Yeah,
say from experience, right? Like other people would tell me, I don't know how you get all this stuff done. And I was thinking, I don't know how I'll survive if I don't get all this stuff done. It's kind of like an adrenaline junkie, I guess, kind of thing. Like I just always needed to be on.
right.
Really hard to just sit and do nothing. I've had to really work at being okay to just sit back and look up at the sky and watch the clouds for any period of time. People will say I'm exhausted, but they have trouble sleeping. Things like my doctor tells me that my labs are normal, but I don't feel normal. People who feel anxious all the time usually have nervous system dysregulation. If you can't lose weight, right? So weight is a safety mechanism and your body won't let it go until it feels safe enough to do so because it thinks it needs to protect you from something.
Huh,
Those are some common things that I hear patients say that make me think, we
yeah.
probably need to do some nervous system work.
Huh. I did not know. You're teaching me a lot of stuff today. So,
Every
I
once in a
hear this
while, I'll
often,
hit the nail on the
honestly.
head.
So this one is huge for me. This is just a question I really wanted to ask because in faith and in a lot of churches, you will often hear that a diagnosis means, if you're not healed from it, you just didn't have enough faith. You don't need the medications because you didn't have enough faith. Or because if you had enough faith, I apologize, you wouldn't need the medications. And this is something that through what I do, I have had a lot of people come to me about, and it breaks my heart. And even people believing, they didn't get healed because they didn't have enough faith. So, what would you say about people who feel conflicted between medication and God?
Well, I don't think it's one or the other. I don't think they compete. I feel like God gave us wisdom. I feel like, in the Bible, Luke was actually a physician. Why would he give us that detail if he didn't want us, if that didn't mean something and want us to tap into that? God gave us the ability to discover medicines and perform surgeries and develop treatments that save lives every day. I think it's important that it's not a lack of faith or anything, whether people get healed or not, because we got to understand that sin is the reason why we have all these things, period. And because of
Right,
sin, we have to go through things and we suffer, but that doesn't mean that person's individual walk with Christ is any more or less faithful than someone else's. It's just the fact that we live in a sinful world, period. Um,
yeah,
I think healing comes in different ways, and medications are just one of the ways that healing comes. But I definitely think people's outlook and their relationship with Christ and how their faith is can possibly give them a better outcome, because there are studies that show um, that someone with a positive outlook and a hopeful outlook definitely makes more progress than someone who is a pessimist or always sees the worst in things. So, like, it really does matter if you're a glass half full or a glass half empty kind of person. So, if you
right,
have a natural tendency to be more negative, then it's just like any other muscle. You got to work at strengthening that, just like you have to work at, um, you know, strengthen your relationship with Christ. You do that by praying and reading the Bible. But I have
right,
seen numerous times where people who could be the sickest and have no positive chance of recovery from something can have the greatest testimony because they are sharing the love of Christ. So I don't
yeah,
think somebody's walk has anything to do with whether they get healed or they don't. I think it has just a lot to do with
I
God
agree.
gave us resources and we need to tap into all the resources.
Right, yeah, I love that because, I've always said God blessed us with doctors for a reason,
Hmm.
so
Yeah.
definitely utilize them. So how do you help a patient discern when a medication is helpful and when alternative approaches might be better?
So I oh I do have patients come to me a lot. It's like, I want to get off these medications. And I kind of have to say, okay, well, let's slow down a little bit. The medicines have served a purpose and they are, maybe keeping you stable. And we always need to evaluate removal of medications from a place of strength. Because again, the medicine's covering up a symptom. If we don't address
Yeah.
why you are having the symptom and do things that can make that symptom go away, then there's no chance to remove the medicine. So I think it's
Right.
more of a stepwise approach um, than what people think. They also usually most medications you just don't stop cold turkey. It's a process. Your body,
Right.
adapted to it. And especially when we're dealing with hormones or other neurotransmitters, you don't ramp it up fast and you don't get rid of it fast. Um, if you do, you just kind of experience some craziness and some weird symptoms that just aren't necessary. So I
Yeah.
would say, I usually work with patients several months before we'll have the conversation of, can something start to be removed? Can we work on that?
Right.
Because the
Right.
work
And
involved
that's
in
the
medicine
greatest.
isn't hard, but it's not what I would call sexy or fancy. But in the society that we live in, it can be hard to implement, and it just takes time.
Right. Yeah, absolutely. So, aside from being a pharmacist, how do you also help clients on the side?
Well, I work through memberships and I just help people with their unique situations and help them navigate what is positive for their situation and what's negative for their situation. And obviously, right, try to help do more on the positive side and then reduce the things on the negative side. And it's just a journey. It's just walking with patients and helping them see and realize what is serving
Yeah,
them
absolutely.
and what's not. So I'm more of
Yeah,
like a coach.
I love that.
I can tell people what to
Right.
do, but they have to see it and they have to want it and do it. And it makes more of an impact for sure.
Absolutely. Absolutely. So, if one of our listeners are interested or struggling with some nervous system dysregulation, how would they connect with you?
Yeah. So on my website, it's drdeborahbowers.com. And you can make a discovery call there and we can chat to see if we can help each other.
Awesome. I love it. And I will share that website in the description. And we will also share the exercises that you mentioned in the description too for you guys. Dr. Deborah, thank you so much for being with us today and just sharing some wisdom. I thank you so much for being with us today.
Yeah. Thanks for having me.
Thank you guys for listening. Blessings to everyone. Mm.